So alcohol is a very bad guy. It does a lot of things, okay, at once, causing an increase in your blood pressure. All right. So alcohol, we all have to be very careful about alcohol. Okay. Then this is the mnemonic. Oh, Vera. So V for vascular, E for endocrine, R for renal, A for medications that starts with the letter A, and O for others. Now let's look at the classification of hypertension. We have primary or essential hypertension, which makes up majority of the cases we see in the clinic. About 95% of patients usually have essential hypertension. And when we talk about essential or primary hypertension, it just means that there is no underlying cause, all right? But when it comes to secondary hypertension, you can actually find an underlying cause, and it makes up to about 5% of patients with hypertension. So this is the classification. So for essential hypertension, there are no underlying causes, but then there are risk factors, okay? And there are several risk factors, okay? Now, the reason why these are called risk factors and not the underlying causes is that having a risk factor does not necessarily mean that you are going to get hypertension. It only increases your risk of getting hypertension. For example, we have the African race, okay, as a risk factor for having essential hypertension, but not everybody who is an African develops hypertension. It only increases your risk. Okay, so that's why it's called a risk factor. A lot of health workers are stressed, all right, but not every health worker is going to get hypertension, all right. It only increases your risk, but it's not for a fact. It's not certain that you are definitely going to get hypertension, all right. So that is why they are called risk factors. Okay. If you are on the ward, you are on the OPD, okay, you are asked, what are the risk factors for essential hypertension? You don't just start saying stress, African race, obesity, sedentary lifestyle. No, you don't do that. You need to be organized in your thinking, all right? So that you look very smart and very polished on the word, You get what I'm saying? Yes. So when you are asked, what are the risk factors for essential hypertension? You start by saying they can be modifiable or non-modifiable, and it applies to various conditions. Anytime you're asked what are the risk factors for this condition, always group it into modifiable and non-modifiable. That way, you are able to remember as many risk factors as possible for that particular condition. But we are dealing with essential hypertension, okay? And for the non-modifiable risk factors, we have African race, positive family history, male sex, and elderly. Now, how would you remember this easily? The way to remember this is to create a story around it. Okay. Now, everybody is born within a particular continent. All right. So, for the non-modifiable risk factors, you were born in Africa, right? So we are creating a story. Okay, you came from Africa, right? So that's a continent you were born in. And you can't just, you are not born into space. You usually come from a family, all right? So positive family history. And when you are born, you are either a male or a female, so male sex. And eventually you are going to grow old, isn't it? So elderly. So this is the story that helps you to remember all the non-modifiable risk factors. And you can also apply it across other conditions. Okay, some conditions you have Caucasians being the non-modifiable risk factor. Okay, being female being the non-modifiable risk factor. So just crafting a story around the non-modifiable risk factors will help you to remember all of them. Remember that you come from an African continent. When you are born into a family. After you are born, you are either male or female, and you eventually grow old. All right, so it applies across several conditions. Okay, all right. So that's how to remember the non-modifiable risk factors. How to remember the modifiable risk factors? Now, modifiable risk factors include stress, sedentary lifestyle, obesity, low fruit and vegetable intake, excessive salt intake, alcohol, and smoking. All right, let's create the story. When you're stressed, you don't want anybody to disturb you. Like you just want to mind your business, lie down and think about your life, isn't it? All right. So when you're stressed, you usually be sedentary. You just go and lie down. You don't move. You do not exercise. Okay. Once you're not exercising, once you're not moving, you increase your risk of being obese. Okay. And also, usually when you are stressed, a lot of people don't take fruits and vegetables. They like to take junk food, and then a lot of junk foods have excessive salt within them, right? Like the fries and all of that. They have a lot of salt within them, okay? And to cope with stress, aside not taking fruits and taking a lot of junk, some people like to take alcohol and smoke. Okay, so that is the story that can help you to remember all the modifiable risk factors for essential hypertension. You see, it's very simple. But let's look at how these risk factors contribute to hypertension. Remember, you need to look at the BP equation. Blood pressure is equal to cardiac output times systemic vascular resistance. All right. Now, let's look at genetics or ethnicity that is coming from an African race. So studies have shown that the African race, all right, a lot of people coming from Africa are usually salt sensitive. Why is that? The reason is because usually Africans have a relatively more suppressed RAS system as compared to others. Okay. Because our RAS system is suppressed, we are more sensitive to salt, dietary salt. Okay. So anytime you take in salt for blacks, there is a usually about a 5 point increase in your blood pressure after taking salt. Okay, so once you take in salt, it leads to water retention. Okay, and then your blood pressure goes up. So that is the black response to dietary sodium. Okay, so we are more salt sensitive as compared to the Caucasians. Okay, and we also have a more sensitive sympathetic nervous system. All right, so studies have shown that our sympathetic nervous system usually gets activated faster than the the whites. All right, so that is why blacks are more at risk of having hypertension. Okay, so salt sensitivity, and we have an increased, sensitivity when it comes to our sympathetic nervous system. All right, stress. How does stress? And you know that once your sympathetic nervous system is activated, cardiac output and systemic vascular resistance will increase, leading to an increase in your blood pressure. All right, then stress. Okay. Usually, stress will lead to the production of cortisol, and cortisol is known as the stress hormone. Once you release cortisol, it activates your sympathetic nervous system. Once your sympathetic nervous system is activated, you have an increase in your cardiac output and systemic vascular resistance, which will lead to an increase in your blood pressure. All right. Alcohol. Alcohol also increases your blood pressure. Okay. How does it do that? Alcohol activates your sympathetic nervous system. Alcohol activates your renin, angiotensin, aldosterone system. And we know that these both increase cardiac output and systemic vascular resistance, which leads to an increase in your blood pressure. Alcohol leads to an increase in the level of cortisol within your bloodstream. Once you increase cortisol, you're going to increase your sympathetic nervous system activity, which would increase your RAS activity. Okay, so it becomes a positive feedback loop. All right, and the other thing about alcohol is that it just doesn't increase these three. It also increases, it also causes endothelial damage. All right. And once you have endothelial damage, there is thickening of your blood vessels and they become vasoconstricted. And that further potentiates, the systemic vascular resistance. So alcohol is a very bad guy. It does a lot of things, okay, at once, causing an increase in your blood pressure. All right. So alcohol, we all have to be very careful about alcohol. Okay. Then obesity. Now, how does obesity lead to an increase in your blood pressure? Usually, those who are obese have insulin resistance. All right, they have an increase in their insulin resistance. And when you have insulin resistance, what it means is that your insulin receptors are no longer as sensitive to insulin as it was previously. Once insulin can't bind to your receptors, okay, once your receptors can respond to insulin, your glucose cannot enter your cells. All right. So even though you have a lot of glucose in your blood, glucose is not able to enter your cells because your receptors aren't working. All right. Your insulin receptors aren't working. So you have a lot of glucose in your blood, but your cells will starve. Your cells will become hungry. Your cells will not have any glucose. Okay. Once your cell isn't having any glucose, it's like what's going on? There is not enough glucose in our cells. We are gonna die. Okay, so it becomes dramatic and stressful. So your sympathetic nervous system gets activated. Okay, that's just a dramatic way I use to remember how insulin resistance activates your sympathetic nervous system and leads to an increase in your blood pressure. Okay, it's dramatic like that. That's how I like to remember it. Okay, the next thing is also about vasoconstriction. All right, from atherosclerosis, where there is fatty buildup, fatty plaque buildup within your arteries, making them smaller. All right. So that's another thing. Okay. So that's how obesity contributes to an increase in your blood pressure. All right. Then high salt intake. High salt intake. So taking a lot of salt, it has been shown to cause endothelial damage. Once you have endothelial damage, it leads to arterial stiffness and then vasoconstriction. All right. There's also something else about taking a lot of salt. It is known that once you're taking a lot of salt, your RAS system, all right, is suppressed. Okay. But then there is something called tissue RAS. We have systemic RAS and then tissue RAS. When you take in a lot of salt, there's a lot of salt in the blood already, so you don't want to activate your RAS. Okay. That's your systemic RAS. However, high salt intake activates tissue RAS, and tissue RAS is found in specific tissues, so in the brain, in the kidney, in your blood vessels. You have tissue RAS, and these lead to an increase in your blood pressure. Okay, so once tissue RAS is activated, blood pressure would go up. Okay, so that's the difference between tissue RAS and systemic RAS. Systemic RAS, generally a high salt intake will suppress your systemic RAS. However, it can lead to an activation of what we call tissue RAS. And tissue RAS is found in places like the brain, the kidney, and the blood vessel. And this can lead to an increase in your blood pressure. All right. High salt intake definitely will increase your cardiac output because you need a lot of water to go and dilute the high salt levels within the blood. All right. So this is how these risk factors increase blood pressure. Okay. Now, there are certain risk factors that specifically increase your systemic vascular resistance. For example, aging. As you grow old, there's loss of arterial elasticity. So your blood vessels are not able to dilate as they would have when you were younger. Okay, that you have no control over. All right. So that is how aging leads to an increase in your systemic vascular resistance. What about smoking? Smoking, all right, smoking, whether nicotine, tobacco, leads to endothelial injury. Once you have endothelial injury, the blood vessels become hardened and all of that, and you have vasoconstriction. All right, so that's how smoking with nicotine, tobacco, that's what happens when you smoke. That it causes endothelial injury and vasoconstriction. Then sedentary lifestyle. You wonder, okay, let's look at the BP equation. I don't see the relationship between sedentary lifestyle and high blood pressure. There is, because when you exercise, all right, anytime you exercise and you're very active, blood needs to get to your muscles that are working. So your blood vessels dilate so that enough blood can get to your muscles. So as the blood vessels are dilating, that elasticity is working. Okay. But if you stop exercising, you're always sedentary, the vasodilatory tone of the blood vessels are lost. They begin to, the vasodilatory tone goes down, it decreases because you're not putting, effort into moving. You're not making your muscles active. So your blood vessels do not dilate. All right. So they remain stiff. Okay, they do not dilate, they are not as elastic. And once they are not dilating, they become stiff, and then you increase your vasoconstriction and you increase systemic vascular resistance. All right, so that is how having a sedentary lifestyle leads to an increase in your systemic vascular resistance, which ultimately leads to an increase in your blood pressure. Some people go to church every Sunday, all right. Some go even multiple times in a week, okay. Some go to parties and all of that, but they don't dance. They don't move their bodies. If you don't move your body, your arteries will lose their vasodilatory tone. So you need to move so that your arteries will, they will vasodilate nicely. We've spoken about essential hypertension. We've seen how the risk factors lead to an increase in blood pressure. Okay, now let's look at secondary hypertension. For secondary hypertension, you have underlying causes. What it means is that once these causes are present, you are going to have hypertension. All right. The mnemonic that will help you to remember the causes of secondary hypertension is OVERA. If at this point you haven't watched the short video, the Oh Vera short video, you are missing out. So please go to the hypertension shorts playlist and find the Oh Vera mnemonic video and get your groove on. Okay, so this is the mnemonic Oh Vera. So V for vascular, E for endocrine, R for renal, A for medications that starts with the letter A, and O for others. Okay, so that is it. V for vascular, E for endocrine, R for renal, medications that starts with the letter A and O for others. So for vascular causes, anything that causes a reduced perfusion to the kidneys, we can classify those under vascular causes. So coarctation of the aorta, renal artery stenosis. And once you have reduced perfusion to the kidneys get injured. Once the kidneys are injured, they will lead to the production of the kidney hormone, which is called renin. All right. So that is how these vascular causes lead to an increase in your blood pressure. They do that by increasing the levels of renin, which then activates all the other parts of the RAS system. Okay, so that's vascular. E for endocrine. So for endocrine, there are a number. So we have things like primary hyperaldosteronism. That is Conn's syndrome. Remember, within the RAS, we have aldosterone. Okay, and aldosterone puts a lot of salt in the blood. Once you have a lot of salt in the blood, water follows. So imagine you have a situation whereby your aldosterone levels are too high. Okay, we see that in Conn's syndrome. That means that you have a lot of water retention, which will lead to an increase in your cardiac output and then lead to an increase in your blood pressure. Okay. Now, Cushing's syndrome. Cushing's syndrome is a condition where you have a lot of cortisol within your blood. And we know that the cortisol is a stress hormone. Stress hormone leads to an activation of what? Your sympathetic nervous system. Once your sympathetic nervous system is activated, cardiac output goes up, systemic vascular resistance goes up, and you have an increase in your blood pressure. All right. We also have pheochromocytoma. Pheochromocytoma leads to a production of excess catecholamines, adrenaline, noradrenaline, and all these are sympathetic nervous system hormones. Okay, so once they are in excess, you have an activation of your sympathetic nervous system. Okay, and remember, sympathetic nervous system and RAS are love birds. So if you activate sympathetic nervous system, you're going to activate RAS, and then the cycle continues. All right. Hyperthyroidism, a high T3, T4 level will lead to an increase in your heart rate and a lot of things that will eventually lead to an increase in your sympathetic nervous system. All right. So this is how these conditions increase your blood pressure. All right. But you wonder, how does hypothyroidism also cause hypertension? Because you know that once T3 and T4 are very low, everything slows down, including your blood pressure goes down. How there is something that occurs with hypothyroidism, and it is arterial stiffness. All right. So usually in hypothyroidism, the arteries become stiff, okay, and this leads to vasoconstriction. And by doing this, you are increasing systemic vascular resistance, and that is how it contributes to hypertension because of the increase in systemic vascular resistance from the arterial stiffness and vasoconstriction. Okay, so when you see somebody who has low T3, T4 levels but high BPs, you shouldn't be surprised. It is because of an increase in systemic vascular resistance. And knowing this fact can help you to stand out. All right. Okay. So we've seen vascular, we've seen endocrine. Let's look at renal. Anything that will injure the kidney will lead to an increase in the production of the kidney hormone. The kidney hormone is called renin, and renin is the first part of the whole RAS cascade. So once you activate renin, you're going to activate angiotensin 2 and then aldosterone, which will lead to an increase in your BP because now you have salt being put in the blood and water following, leading to an increase in blood pressure. All right. And remember, once your RAS is activated, you're going to increase your systemic vascular resistance and your cardiac output. Okay, so which conditions do that? We have chronic kidney disease, polycystic kidney disease, glomerulonephritis, and then diabetic nephropathy. Okay, so these are the most common causes when it comes to secondary hypertension. The renal causes are very, very common. Okay, then medications that starts with the letter A, some antipsychotics, some antidepressants. Okay, so you see that they start with A. Some antipsychotics, some antidepressants, anabolic steroids, analgesia, specifically NSAIDs, and then amphetamines. So these are the A medications that lead to an increase in your blood pressure. Okay, then we come to others. That's the O for others. Okay. So conditions like obstructive sleep apnea. You see, it starts with O. Obstructive sleep apnea. When you have obstructive sleep apnea, there is hypoxia, isn't it? So you're not getting enough oxygen. Okay. So the person is in a state of is in a hypoxic state. All right. Once there is hypoxia, the sympathetic nervous system gets activated. Remember, just like diabetes, you're not getting enough glucose in your cells. The same way, you're not getting enough oxygen in your cells. So the body gets worried. Like, what's happening? We are dying. We are dying. Let's do something. Let's do something. And the body gets stressed up, and that's how your sympathetic nervous system gets activated. Okay, that's just a dramatic way of remembering that. Okay, then we have your drugs. Certain drugs like oral contraceptives. Okay, so some oral contraceptives actually increase your sympathetic nervous system activity, which leads to an increase in your blood pressure. That is why it's important to take a good history from someone who has to be on contraception. And maybe they have a strong family history or they themselves are hypertensive. You want to offer them the non-hormonal, contraceptions like the copper IUDs, etc. Okay, all right. Then cocaine. Cocaine is also a very potent vasoconstrictor, like notorious for making your blood vessels vasoconstrict. Okay, it's a very bad guy. All right, so you have to be careful about cocaine. Okay, once you have potent vasoconstriction occurring, once you have vasoconstriction occurring, that leads to an increase in your systemic vascular resistance. Once you increase systemic vascular resistance, you are going to increase your blood pressure. All right. So, what is the secret sauce? The point is that blood pressure is equal to cardiac output times systemic vascular resistance. If you increase cardiac output, you increase blood pressure. If you increase systemic vascular resistance, you increase blood pressure. And if you look carefully, you realize that all the risk factors increase blood pressure by increasing your cardiac output or your systemic vascular resistance, or both, or they activate your sympathetic nervous system or your renin angiotensin aldosterone system. And once you activate sympathetic nervous system, you're going to activate RAS. Okay. And once you activate these two, you're going to increase your cardiac output and your systemic vascular resistance. All right. And then when it comes to the secondary hypertension as well, you realize that all the causes of secondary hypertension, they either fall under factors that increase your cardiac output, your systemic vascular resistance, or both. Okay, or they increase your sympathetic nervous system activity or your RAS activity, you see. So whatever you do, it all boils down to the fact that hypertension is due to factors that activate the sympathetic nervous system or the renin angiotensin aldosterone system or factors that will increase the individual components of the BP equation. So you can task yourself, give yourself a quiz. I just want to play around why all these risk factors and all these underlying causes of secondary hypertension lead to, an increase in your blood pressure. All right. So you can pick one factor, you can pick one underlying cause and reason around it. Okay. For example, Conn syndrome is primary hyperaldosteronism. And I know that aldosterone means that an aldosterone will put a lot of salt in the blood. Once there is a lot of salt in the blood, there's going to be water retention. That will increase my cardiac output and my BP is going to go up. You see, I can choose sedentary lifestyle. If I am not active, my blood vessels will lose their vasodilatory tone, and that will lead to vasoconstriction and will increase my systemic vascular resistance. Once I increase systemic vascular resistance, I increase my BP. Then you find another one, maybe alcohol. Alcohol is a very bad guy. It increases sympathetic nervous system activity, RAS activity, increases cortisol levels, and causes endothelial damage. All these things will increase cardiac output and increase systemic vascular resistance and lead to an increase in my BP. You see, so that's how you play around it. So you just need to think around it and find which one causes what. Which one leads to an increase in cardiac output? Which one leads to an increase in systemic vascular resistance? Which one leads to an increase in sympathetic nervous system activity? And which one leads to an increase in renin, angiotensin, aldosterone system activity? All right, so that's how you go about it. Okay, where will you find this? But on Dr. Mira Teaches. So please, you have to subscribe, subscribe, and like, and share, and comment. Okay, all right. Now let's understand, why is hypertension chronic? The reason why hypertension is chronic is because persistent high pressures, all right, will damage the arteries. And anytime the body begins to realize that no, blood pressures are too high, it's going to affect us, all right, the arteries, respond by thickening. Okay, and in that the process, they undergo arterial remodeling. So that arterial remodeling process causes the arteries to thicken so that they can withstand the high pressures. But when you undergo arterial remodeling and then the arteries are thickening, it reduces the internal diameter of the artery. So you are rather increasing your systemic vascular resistance. So you are making it worse. And remember, once you increase your systemic vascular resistance, you're going to increase your blood pressure. Okay, so this arterial remodeling and endothelial dysfunction from the persistent high blood pressures, okay, will reduce, the internal diameter of the artery, all right? And if you don't treat it early, the remodeling, all right, becomes permanent. Okay, there's lots of vasodilatory tone because of that thickening, all right? And once it's permanent, you have a permanently increased systemic vascular resistance, and then the BP will remain elevated, right? So that's why hypertension can become chronic. The chronicity is more centered around the systemic vascular resistance because of the arterial remodeling that occurs. So that's why you need to arrest hypertension quickly. So I hope it was very, very understandable. Okay, so until next time, keep learning, keep studying, keep shining, and glow like the African sun. Bye.